Soul Support is a collection of programs that we offer to the community that focus on mental health. We have found that partnering with the Congregational Health Network has a greater impact with getting our message across. For so many people, their faith community is like a second home, and they feel very safe and protected here. By having these kind of classes and workshops available in their faith community, it allows us to come in and really get the message across.
The biggest takeaway from the suicide prevention workshop was the protocol in how to approach people. I'm a hairstylist, and I noticed when they come and sit in my chair for the first time and they tell me that they want to shave their heads, usually that is a sign that something is going on in their lives. But usually always when I try to dig a little bit, it's always something negative. And that having a protocol in how to proceed and speak to them, that really will help me in the future.
The biggest takeaway from the workshop for me is that you cannot take anything too lightly, and you cannot dismiss anyone who is talking about ending their life or is going through a situation. For example, when Julie was talking today about people saying, I'm tired, I want to go to sleep. A lot of my patients say that to me, but it was an aha moment for me, thinking it may not just be because they're old, but they might be going through something. So I'm no longer going to just dismiss the idea that it's not suicide.
Many times when I'm doing suicide prevention workshops, people are nervous about asking someone if they are suicidal. They're afraid that if they're not, what if I've planted a seed in their head or given them an idea? But the research shows it's actually the opposite. Asking someone if they're suicidal reduces the risk of them acting on those thoughts.
Another thing that I learned today is when Julia mentioned that when somebody has an accident, to break their hip, and then everybody in church take turns making food and this and that, but we really don't support, like if a person is having a nervous breakdown. That's what I hope for our church. It's like to get tighter, to be able to express exactly like what's happening in our personal lives and ask for help.
A new aspect of Soul Support that I'm really excited about is thanks to funding that we got through a grant from Melina Cares Foundation. They offered us money to be able to provide scholarships for individuals within the faith community to become QPR suicide prevention instructors. This way, they can then go out and do trainings on their own within their own communities.
I see a lot of kids or adults and elderly that are dealing with a lot of problems because the population that I serve is Spanish speaking. So the majority of them are immigrants. A vast number tend to have suicidal thoughts or even attempts. The community needs to be informed, needs to be educated about suicidal thoughts that exist, what to do, what to ask.
I hope that the church members took away that there's nothing wrong with having the conversation about suicide, and that it's not something that has to be seen as evil or deviant. It's, as Julie said, it's a symptom of an illness. It's a symptom of maybe depression or something else that you might be dealing with.
One of the most crucial messages that I want to get across in my presentation is that hope is real, that recovery is possible. We spend so much time being afraid of having a mental health crisis or being afraid of having a mental health diagnosis, and they don't understand that that's not the end of your life, that people can still live a wonderful, fulfilling life with a mental health diagnosis.